So today I'm with Eric Vickery, president of coaching at All Star Dental Academy. And I want to talk about referral programs. A lot of our clients know that getting referrals from their existing patients is important, but they don't really know how to go about it, what to say, what to give away. And so I thought phone a friend, if you will, and get with Eric. And since he is a master of all of these things, in terms of operations, and give us a little help. So, Eric,
Love
thanks
it.
for jumping on with me.
Andre at Pain Free Dental Marketing. Yes, yes, we are becoming a dynamic duo here with our videos, and I love it. The referral program, if you want to call it that, is an essential part of your business. It is a part of the business, so much so that it has to be a daily conversation. So let's start first with understanding how much of your daily conversation plays a role in this. So we use the 80-20 principle. I'm sure you know the 80-20 principle. So
Pareto's rule.
yes, Alfredo Pareto, that dude. So he figured this out. How we use it is, your top 20% of your patients create 80% of your success. Your bottom 20 patients create 80% of your problems. Those are the people who don't show up, don't pay their bills, etc. So all we're going to do is focus on the top 20%. So when you think about what we talk about today, just don't think about, I'm doing that with every single patient. No, we're just doing this with our top 20. You get to define what a top 20 is in your practice. It could just be people you really get along with, you really love, who value what you do. It doesn't have to be just about the money. Birds of a feather flock together. We're going to target this audience, our top 20 demographic, you might say. And then as we ask them, the goal is to get more people just like them in the practice. Does that make sense? Okay. So at Morning Huddle, I'm the hygienist. I'm going to identify 2 patients a day in my schedule, 1 to 2 every single day. And they're going to be people that already like me, that already know this conversation is going to go well with, because they're not grumpy patients. They're not negative people. They're not lukewarm people. They're people that I already know really like us. Okay. So identify them at Morning Huddle. We're having our meeting and you're going through your agenda and you say, Eric, who are you going to ask referral today? And I say, I'm asking Ricky Bobby and Joey Tribbiani. Those are my 2 patients I'm asking today. And then I go do it. Now we'll get to the verbal skills, but tomorrow at the Morning Huddle, you're going to say, Eric, how did it go yesterday asking Joey and Ricky for the referrals? I'm going to look at all my peers in the room and go, oops.
I forgot.
Ooh, I forgot. Right? So we got to create accountability with this. That's what will make the difference for your team to really get this going. You do not need to ask 24 patients a day for referrals. Just 2. Just bite-sized pieces and do this really well. And then the same thing that happens tomorrow is you say, all right, and who are you going to ask today? Who are your 2 today? And I give you 2 more names. You write that on your Morning Huddle agenda. Then tomorrow we go back to it and we review it. And it's not just me. It's each hygienist, it's each assistant, and it's a doctor. It's probably not the administrative team unless they have a really great relationship with that patient and they have a private area where they can have the conversation. Does that make sense?
Yes, but I want to clarify something. What you're saying is there's one person who is responsible for this program and is deciding who we're going to ask and who's going to ask.
One person who's saying, hey, who are you going to, each of you going to ask? And I'm going to write it down every single day. Me as the provider, I know my patients. I know on this list of 8 people who are coming today, who are my top 2. Now I might have 4 today that I want to ask and tomorrow 0. That's fine. But on average, about 2 patients a day. It's actually 1.5. So 1.6. So we're going to ask this number of patients. What is that? 6 patients a week at a 4-day work week. That's all you got to do. And if everybody's doing that, then we're golden. Now, systematically, we got to make sure we protect each other. Let's say it's Dr. Andre. I'm Hygiene Eric. Okay. So I ask Ricky Bobby for the referral. I go through the verbal skills, which we're going to talk about. I need to note it in my dental software. Okay. That I asked, not in the clinical notes, because that'll disappear. But let's say you're using Dentrix in Family File patient notes. Maybe EgoSoft and a patient memo. Okay. But you're going to date it. You're going to say you asked Ricky Bobby for the referral and his response, my initials. Because in 2 weeks, you're going to do the same thing at Morning Huddle. You're going to go, oh, Ricky Bobby's coming in for a crown today. he's such a great patient. Let's ask him for a referral. And you're going to do the same exact thing over again in 2 weeks. And Ricky Bobby's going to think something's up, right?
Yeah, like we don't talk to each other.
Exactly. And why are they asking me the same exact thing again 2 weeks later? Now, 6 months from now, when he's back in hygiene, there's a follow-up we can do, which we can talk about.
Mm-hmm.
All right. So let's talk about the verbiage that we use in this process. I use 4 steps. No scripting here, but concepts. So I'll go over the concepts, then I'll actually ask you. You get to be Ricky Bobby today.
All right.
And so 4 steps. Number 1, I'm going to compliment the patient. 9 times out of 10, when I ask a patient, or when I compliment the patient, they compliment back. They'll say something like, "Oh my gosh, I love this office too. You guys, I used to be afraid of the dentist, blah, blah, blah." Okay. Number 2, I educate them on the type of patient we're looking for. Number 3, I ask for their help. Are they willing to help? That's a key word. And comfortable helping. And lastly, whatever that next logical step is. So those are the 4 steps that we're going to use. Mm-hmm. All right. So let's say we're there. Now, you and I have had I don't know, we're 2/3 of the way through the hygiene appointment. We're talking, maybe we're getting closer to scheduling. And I say, I'm not going to make you Ricky Bobby. I'm going to make you Andre. So I'll say, Andre, I got to tell you, when we do our morning meetings, we always go through our patients, and doctor really wanted me to point out to you how much we really enjoy seeing your name on the schedule. You are always the delight to have. You show up for your appointments. You're just really, really, you're just one of our best patients. And I got to say, thank you for being a great patient at practice. Thank you so much.
Oh my gosh, thank you. I mean, I love coming here. You guys are so fun and so friendly. I didn't like going to dentists before, but I really like to come and see you guys.
I love hearing that. We've tried doing dentistry without patients. It doesn't work really well. So having patients to care for who value what we do makes it so, so worth it. In fact, we are strictly looking for a very particular type of patient in our practice, and you fit that mold perfectly. And in fact, we're looking for more people like you. So birds of a feather flock together. You know what I mean?
Mm-hmm, mm-hmm.
Some people don't even know that we're accepting new patients, that we're growing our practice. And I got to say, we're a bit picky about that. And so we're wondering if you'd be willing to help us out. Are you comfortable recommending us to your friends, family, coworkers?
Oh yeah, I mean, I do it all the time.
Oh my gosh, that's so great to hear. That's awesome. I love hearing that. Thank you again. That's awesome. So we have some referral cards. And the reason these are important is if you invite someone to our practice as your guest, they get special savings when they come in. So I would love to give you some cards that you could give to people as it comes up in conversation so that they can receive that benefit when they come into practice. Would that be okay?
Yeah. That sounds great.
How many do you want? You want 5, 10? You want 50?
5 sounds great.
5's great. All right. Bang, bang, bang. 5. Here you go. All right. Good job, Andre. 10 points, right?
10 points.
10 points. Write those down. Okay. So a couple of things. One, if I chicken out and I just do step 1 and I appreciate you, it's probably great. You probably just feel better about the process. You go, wow, my dental office appreciates me.
Mm-hmm, mm-hmm.
Now, I'd say don't do that. Keep going. Number 2, you get to make it your own. I'm going to make it based upon this person I'm interacting with, your disc personality, the length of time you've been in the practice, how well I know you. I might add some personal flavor to it. When you first came in, Andre, remember how it looked? And you could do some things like that. So make it personal for that person. The third thing you have to make sure you do is, are you comfortable helping us out? That is a key verbal skill phrase. Lastly, ask. It's an ask. Are you comfortable doing this? If they say no, you could scoot to a Google review. If they say, no, I don't talk religion, I don't talk politics, and I don't talk dentistry. Okay, well, how about a Google review online? Is that something that's more comfortable for you? Nope, I don't do that either. Okay, strike 2, I'm out. Now, key factor, I'm going to put this in the notes like we talked about before. And I'm going to say, do not ask them for a referral. Okay, but if I do, and it goes well, I'm going to say, ask for referral, gave 5 cards. Now, Larissa, who's answering the phone up front, gets a new patient that comes in. You referred them. You refer Ricky Bobby. Ricky Bobby comes in. She goes to your note, puts a new date light in. Ricky Bobby came in on this date. And we follow the note. Sent Andre thank you gift. This is a key part of this. Patient comes in. Andre comes in to see doctor, right? Doctor personally thanked Andre for referring patients to us. You might not have to share names if you don't want to, but you can. You're not connecting a name to treatment or anything, you know, but a thank you to you goes a long ways. So system verbal is in the morning huddle, identify who you're going to ask, use the right verbiage for asking, 4 simple steps, document what you're doing, and then send the thank you gift. Now, our thank you gift that we've seen work on this would be a nice Hallmark gift card, style card. Everybody signed it. In the middle, it just thank you so much for continuing to trust us with your friends and family. Don't name names, just like that. And then in there is an Amazon gift card. Now, don't be cheap. Don't make it $4. Look, $4.44 left, right? I used it for a while. This is what was left. I sent it to you. No,
Yeah.
make it like $25, or you can go up from there, right? What do you think?
I like it. There's a lot of things there that you said that I think are really super important. I obviously all 4 steps are important, but in the talking about patients just like you, that's such a huge compliment, right? And
Mm.
everybody wants to be seen and feel valued. And I know that I don't like scripts either, but I letting them know people just like you, to me that one is huge.
Yes.
Um, I think asking them for the help,
Mm-hmm.
I think sometimes our clients think that the referral program success is going to be hinged on what is the prize or what did they get, what does the referring patient get. But what I find is that people are doing it because they want to help you. It's not about the $25 gift card. It's not about anything else besides the help. So when you ask them, are you willing to help me out personally? I think that part is really critical. You know,
Agreed. Yeah. And because you know they're a great patient, they're going to go along with it. Even if they don't feel comfortable with it, they're still going to say, okay, yeah, so you don't have to worry about that fear of rejection. You gave them cards. Now let's flash forward 6 months. You're now back in again. Oh, Andre, we're through the appointment a bit. Andre, I can see last time you're in, I gave you a few referral cards and maybe even see some notes that some people came in there. I could thank you for that personally. But let's say there's nothing there. I say, Andre, I know last time I gave you a few referral cards. Thank you for taking those. Do you feel like you could use more of them, or are you all set? If you say all set, I'm going to put a note in there. No need to ask him any more for referrals. Read between the lines, right? But if you
mhm.
go, oh yeah, I've had a few, I'll take some more. Okay, great. I don't have to go through the whole system again.
Yeah, that's good. It's a way to remind them also without, being
Being pushy.
too pushy.
Yeah.
The other thing I would share for when listening on in terms of the gift, I like the Amazon gift card because it's super practical. And who doesn't love Amazon?
Yeah.
But from a marketing perspective, another thing that I like is if there's a local business, so a local coffee shop, a local bakery, so not Starbucks. I like
Mm,
using those because oftentimes in this day and age, patients that receive those thank yous will share something in their social media and tag the coffee shop or the bakery. And those small
good.
businesses are also looking for content for the social media, and they're more likely to reshare and repost that post.
Yeah.
As
Ripple
where
effect.
Starbucks is never going to reshare your content, but a local business does, and it gives you a little bit more exposure. And I also think that it just positions the practice as a business that supports other local businesses and makes you part of the community. So I like that extra touch too of using a local, again, coffee shop,
Yeah.
bakery
Agreed.
sort of thing.
And I bet if you bought your coupons in bulk, they'd probably give you
Mhm.
some savings on it too. So your $25 is going to go further.
Yeah, I've seen practices that start with something like that, and then the coffee shop sees them, and they strike a little bit of a partnership where maybe they put, wherever new patient visit, you get a free coffee, and they put something on the lobby at the coffee shop promoting the practice. So it can be the beginning of a local, relationship too.
Yeah. Mutual win-win benefit.
Hmm.
One last thing, responsible leadership. So if you're the lead person for this in your practice, it does not mean you're the one going around asking for all the referrals. That's not what that means. Responsible to, not responsible for. I'm responsible to making sure Naomi makes her bed, my daughter. I'm not responsible for making her bed. Okay. So as the leader, I create accountability. I say, Naomi, how'd it go making your bed this morning? I don't say, did you make your bed? I'm
Mm.
assuming I'm creating accountability. It's an accountability question. I'm implying that, of course, you did it. How'd it go getting your homework done? How'd it go making your bed? How'd it go cleaning your room today? It seems silly to ask it that way, but it's received so much better when you do it that way. So we're team members. Andre, how'd it go asking Joey for the referral yesterday?
Oh man, I meant to, but the conversation just slipped away. I didn't.
Okay. Well, you know he's a top 20. Let's get him next time when you have the conversation. Just continue to build up to that, okay? Who do you have for today that you want to ask?
I have Sally Bobby.
Sally Bobby. I'm stealing that. Sally Bobby. Awesome. All right. Well, let's look, put this into action. Go for it. Track. By the way, tracking is the next part of this system. Track who you're asking, how it's turning out. We have a tracker for that as well, right?
Yeah, no, I think that part is super important. Not just tracking how many new patients you're getting from the referrals. I think everybody knows to do that, but tracking how many asks happened, how many requests happened throughout time, because you're going to be able to see if you're asking quite a few people, you're asking your 2 people a day, and you're not getting actual new patients from it. I think that sometimes can be a red flag that something is going on in the practice that people aren't willing to refer you. Right.
It's like not getting Google reviews. Yeah. Yeah. For me, when it comes to tracking and all of this, I want to, what you measure, you improve, right? And
Absolutely.
so make sure you're tracking it. Maybe you even have a game on your team where there's a reward for that too. Give out points if you want to,
Yeah.
however you want to do that. But make this a win-win for your entire team.
This has been great. Eric Vickery,
Awesome.
president of coaching at All Star Dental Academy. How can someone watching this, get in touch with you if they need help executing this program?
Yeah. So Eric at allstardentalacademy.com, Heather at allstardentalacademy.com. We're here to help. Our whole team's here. We'll figure out what you're looking for and help you any way we can.
Thanks so much, Eric.
Thank you.